From the Toronto Star, I'm Adrian Chung, and this matters. The best vaccine is the first vaccine you can get. Doctors have said that time and again. But right about now, how do people who got the AstraZeneca shot feel? In scientific terms, the AstraZeneca shot is great and it's effective, especially against serious COVID illness. Millions of Canadians got their first dose of it, but it rarely gets talked about in glowing terms anymore. NACI, Canada's Advisory Committee on Immunization, called the mRNA vaccines like Pfizer and Moderna the preferred ones over AstraZeneca. The guidance keeps changing too. First, it was paused for certain age groups. Then Ontario stopped all second doses of AstraZeneca. Now, NACI is actively recommending people to get an mRNA shot as their second dose. Underpinning all of that is the very rare but potentially deadly side effect of blood clots. Even if the science is on AstraZeneca's side, in practice, the shot is treated as a lesser vaccine. Joining the podcast, my two colleagues at the Toronto Star, May Warren and Alex Boyd. May has reported on how reopenings are reacting to AstraZeneca. Alex is following the latest national guidelines and mix and matching of doses. We're talking all things AstraZeneca. What happened to the shot? Why has it gotten all this bad press? And what happens to the hundreds of thousands of doses Canada still has? May, Alex, great to have you both here to talk.
Thanks for having us. Hi, May.
Hi, thanks for having us here.
Haven't seen May in a while. It's exciting.
Yeah.
It's
good to see your face.
Virtual meeting room we got here. At this point, you'd have to forgive someone who got the AstraZeneca shot, the first dose rather, to be very confused by what's going on and what the latest guidance is because it keeps changing. So Alex, I'll turn to you first. What is the latest guidance from NACI when it comes to the AstraZeneca shot?
So the latest thing, the thing that came out last week is new guidance that says if you got AstraZeneca as your first shot, they're recommending that you get one of the mRNA shots. So we're talking about Pfizer or Moderna as your second shot. And so what they're saying is there is some indication now that it might create a potentially better immune response. So it leaves the door open to choice. If for some reason you feel strongly about AstraZeneca, you can still get it as your second dose. But at this point, their recommendation is that all else being equal, you get one of those mRNAs for your second shot.
But they're also not saying that AstraZeneca is unsafe. They're not saying that, right? Just that mRNA vaccines are preferred. It is confusing.
It is confusing. And honestly, I very much empathize with people who are in this situation are trying to kind of make sense of all the different information here. So this is not about AstraZeneca being unsafe. It's not about AstraZeneca not being a good vaccine. There's really two factors that we're looking at here. So again, there's this very, very rare risk of blood clot that we do see with AstraZeneca. And again, the risk after your second shot is much, much lower after your first shot, but it's not zero. So again, you could eliminate that risk entirely by taking an mRNA as opposed to getting a second AstraZeneca. But at the same time, we're starting to see the spread of the new Delta variant. And there is some indication that Pfizer is slightly more effective against the Delta variant. And again, there's this open question that, researchers have been looking at for months now about whether or not actually mixing vaccines might have some advantage there. So that's kind of what NACI's thinking. They've got some early evidence that mixing and Pfizer might give you a slight advantage here. But again, because of Delta, it's made it a little bit more urgent. It probably made them, make this decision a little bit sooner than they would have otherwise. But AstraZeneca, is still a great vaccine. And I think it's worth making the point that if it was the only vaccine available to us now, we'd all be lined up around the block for it. So, AstraZeneca is still a solid vaccine. If you want to make that choice, I know a lot of doctors are okay with that, but the recommendation is mRNA.
And May, here in Ontario, there has been some confusion around the buffer time between the first and second dose for people who got the AstraZeneca shot. They recently changed it back to 8 weeks, but people were kind of upset that they originally had to wait 12 weeks. Are these, again, more barriers that we're talking about for people who got that first shot?
Yeah, I think, people were upset that they originally had to wait 12 weeks. And as you said, that's now been changed to 8 weeks. But there's just been a lot of changing guidance for AstraZeneca. with the different NACI recommendations, with the Ontario government, pausing the first doses. And I think it's just really hard for people to keep track. Even for us as journalists, it's hard to keep track of all these changes. So I can't imagine what someone who's not following the news closely is thinking right now. And I can definitely understand with all of that changing guidance, comes confusion and maybe some uncertainty.
Yeah, I definitely empathize. I've heard the same thing as May in terms of people being really confused. One point I think is just important to make is that you kind of have to untangle two issues here. One is the science and one is the communication. And I think people are conflating that. And I think that's totally fair. I think the communication has been really a mess in terms of explaining to people what's going on, what the latest advice is. I think that's where a lot of the confusion is coming from. But I think what I'm hearing from people on the science side is that the science here is not necessarily the issue, because when we rolled out these new vaccines, we put in what's called post-market surveillance. So Health Canada is watching these vaccines closely. The companies are watching these vaccines closely. They're gathering any sort of issues. And then they're doing that so that if there are any, what they're known as safety signals, they can make changes or they can kind of tweak guidelines as they're needed. So what we're seeing here is post-market surveillance working. This is the system working. It's telling us we need to kind of make changes as we go. We're learning, we're making decisions based on that. That's all good stuff. So it's not necessarily a bad thing that guidance is changing, but the communication, on the other hand, has been a bit of a mess. So again, I think it's just worth kind of treating those maybe as two separate issues.
It's interesting because when you talk about that messaging, there is this difference between theory and practice, I think, that we're seeing. Millions took the AstraZeneca shot because it is safe. It was the first one offered to them. They did the right thing by all public health standards. And then there's also the reality, because even in NACI's own words, this is not the preferred vaccine anymore. There's a tiered system coming out when it comes to restrictions. So is it about balancing the messaging of what is complicated science and then also assuring people that they did the right thing?
I think that's exactly it. I mean, this is complex stuff. I think in some ways we're getting to see how the sausage is made. Like, one thing I've really learned this year is that, I think most of us really want a binary answer. Is this drug good for me or is it bad for me? That's kind of how we're used to thinking about these things. But doctors aren't like that. They don't think, this is inherently good or this is inherently bad. What they're thinking is, well, here are the pros, here are the cons. Here's the context, here's this personal situation. And if I add those all together, I will lean yes or no on this particular vaccine. And so they're very comfortable with having these conversations around, well, what vaccines do we have available? What is the virus doing? What is the particular characteristics of this vaccine? Like, they're very used to kind of, engaging with the nuance here. But now this conversation is happening in public and people are seeing this happen and go, oh goodness, this is alarming. But in some ways, I think it is just kind of what happens anyway, but just what happens behind closed doors. But I do think there has been not maybe a big enough effort to kind of explain that process and that situation to the average person. When you use words like preferred, it starts to kind of, spook the horses, as they say. So I think there are some issues in terms of definitely how this was communicated. And I very much feel for everyone who's confused right now.
We'll be right back. May, have you talked to people? Have you seen people sort of have almost a buyer's remorse? Again, it may not be founded in the science, but I have heard some friends who are in Gen X who got AstraZeneca, and though they know that it's a safe shot, they've questioned it, at the very least, whether or not they did the right thing.
Yeah, I definitely have heard that. And last week I reported a story about the first Broadway show to come back. Springsteen on Broadway in New York City was not allowing people in who had AstraZeneca, and they had something on their website. Okay, you have to be fully vaccinated, but that means with a FDA approved vaccine or authorized vaccine in the US. So Pfizer, Moderna, or Johnson & Johnson. And I think with that, a lot of people were left thinking like, okay, well, where does that leave me? Am I not going to be able to get into different venues? Am I not going to be able to get into certain countries? Does this not count? Does this not mean I'm fully vaccinated? And a lot of people were upset about that, especially Gen Xers who were Springsteen fans, because as we know here in Ontario, I think the cutoff was 40 and up for AstraZeneca. But the good news is that actually that Broadway venue reversed their decision after an outcry, an international outcry actually, because not only have a lot of Canadians got AstraZeneca, but a lot of people in the UK, Australia, also Germany, and other places. So that was great to see that they reversed the decision and they are going to allow people with AstraZeneca in. And they changed their wording to say any WHO authorized vaccine, which does include AstraZeneca. So that was good news. And that makes me hopeful that, we will see changes if people are kind of misinterpreting guidance or unfairly leaving out AstraZeneca. But definitely that kind of set off like a wave of uncertainty about what AstraZeneca would mean for future travel as we start to kind of open up the world.
Right. So people were obviously maybe Gen Xers, boomers. They were worried about not seeing Springsteen. That's one thing. But more than anything, it was that people were worried that this would extend to other things that we're talking about, whether it's a vaccine passport or reopening, that they might not be allowed in certain scenarios. Is that what you're saying?
Yeah, exactly. And I mean, all of that is kind of uncertain and we're just starting to see, the world start to open up again and some, travel restrictions be dropped. So there is time for, this to kind of be worked out, but there definitely was some uncertainty there. And I think it's worth saying like in Canada, we're in a very privileged position where we do have access to vaccines. And a lot of other countries, particularly in the developing world, don't have that right now. So we are really lucky that we do have them. But at the same time, I really emphasize with people, having that fear about not being able to travel. But I did feel hopeful when I saw that the Broadway venue changed, because that to me was a signal that other places and other countries might do the same. And, as Canadians, we're not the only ones that have gotten AstraZeneca. Many places have used it.
Of course, yeah. Alex, what should people who got the AstraZeneca shot, what should they know? Because more and more of them are shifting over to mRNA vaccines as is recommended for their second dose. So what should they know about their access to that vaccine at this point, mixing and matching? I know you're doing some reporting on that.
Yeah, well, I think the big thing, and I think every infectious disease expert that I've spoken to has made this point in some way or another, is if you have taken AstraZeneca, you should, pat yourself on the back. You should feel good about it because, you made the best decision you could at the time. And the fact that, Canada is starting to hit some of these milestones, like we're starting to see a large percentage of our population with the first dose, a lot of that was done on the backs of, people who ran out and got AstraZeneca. So no one is saying that, you should feel bad about that decision. That said, it's good to keep abreast of the latest research. And so what we know at this point is that Pfizer is slightly more effective against this new Delta variant. For example, there was a study out of Scotland that was published last weekend that found Pfizer is about 92% effective against Alpha, about 79% against Delta. AstraZeneca, it's about 73% against Alpha, 60% against Delta. So Pfizer is slightly more effective against Delta. There's also some indications that mixing might be able to give you a little bit of an edge. And this is something that experts have really been expecting because there's a long history of mixing vaccines within medicine. Basically, triggering your immune system in different ways can sometimes, give your immune system different tools to fight off the virus. So this is not unexpected. That said, what we know right now is there's some real world data from Europe where other countries have mixed and matched, and they're starting to see indications that this could be a useful way to go about things. That said, we don't have large scale trial data. And of course, in science, it's important that we have these, large trials with lots of people where this is really rigorously tested. And so what the world is waiting on right now is this trial out of Oxford. They've been looking at this issue for months. They've been kind of, mix and matching various vaccines. We've seen some early results from that trial. We haven't seen the full results, but that is really what we're waiting on to kind of know a little bit more definitively whether this is a good idea. But NACI is basing their decision on this kind of these real world indications coming out of Europe.
We've talked about it on this podcast before. We've spoken to epidemiologists about this. But even though we're a few months into this, a lot of people still misunderstand what vaccine efficacy means. And I think it's worth getting into that again to remind people what exactly we're talking about. When they see that number, what does it mean?
Yes. And I think this is a really important piece of the conversation that is maybe getting missed a little bit. And it's really important for those of you guys who've gotten AstraZeneca. So when we talk about vaccine efficacy, there's those big percent numbers. Those are the results of those large scale trials that were done earlier this year, where they looked at basically, they gave half the people the vaccine, they gave half the people a placebo, and just basically looked at how effective the vaccine was at preventing COVID in general. So symptomatic COVID or an infection in some cases. And so that's a a really important number that tells us how good the vaccine is at protecting you from the virus and from the disease in general. But it's really only one measure of how good a vaccine is. And so we've learned a lot more about these vaccines as we've gone along. And one of the big things we've learned is that they're very, very good at preventing hospitalization. And so, for example, there was some English data that was released last week that found that Pfizer, so 2 shots of Pfizer, was about 96% effective at preventing hospitalization against the Delta variant. AstraZeneca, about 92% effective. So they're neck and neck in terms of preventing hospitalization, even faced with the Delta variant. So what does that mean? It means that Pfizer might be slightly more effective in preventing you from getting COVID, but they're both very, very good at making sure that if you do get COVID, because none of the vaccines are 100% effective, it is most likely that you will not end up in the hospital. So this is the difference between, being very sick, maybe ending up in the ICU, and being at home with the case of the sniffles. And so I think that's a really important point for those of you who've got AstraZeneca, is that yes, there's slightly less protection overall, but in terms of that protection against hospitalization, you're still in good hands.
So mixing and matching doses, of course, people are already doing that in Canada, and May sort of touched on it there too. The fact that we can list off so many different vaccines in Canada, we know that millions more doses are coming in every month. We are very privileged here, right? For even people to be able to say, I want that vaccine, I don't want that vaccine. That's not necessarily the thing you should be doing. But the fact that people can do that, I think it speaks to the vaccine allotments that are in Canada at this stage.
Yes. I mean, this is something that I, spend a lot of time thinking about, and I'm working on a larger project on this, which I'm hoping to have out later this year. But the fact that Canada has the access to vaccine that we do puts us in a very elite club globally. Most countries around the world do not have anywhere near our access. They're going to be waiting. If you look at India, for example, they've got frontline healthcare workers who are not fully protected while we're, looking at vaccinating children here. And again, this is not to downplay the risk that children face, but, if we were treating the whole world as a country, we would, be looking at making sure doctors everywhere were protected, maybe before we looked at people who were working at home or who were a little bit less vulnerable. So, Canada really is in a very lucky position right now.
May?
And I would just add to that, there's people who are going to end up getting the Chinese or the Russian vaccine that's being used in parts of the developing world. And neither of those are Health Canada approved right now. So I think that's also a bigger issue. Like, what's going to happen to those people if they're fully vaccinated with those vaccines? Are they going to have the same rights and privileges as Canadians that got Pfizer, Moderna, or AstraZeneca? So I think there's a whole host of issues, and especially as Alex touched on around vaccine equity for sure.
Yeah, and you wrote about this emerging almost patchwork of what's acceptable, what's not acceptable, where is it, is this vaccine better? It's happening not just at a provincial level or on Broadway, but it's happening on an international level, really.
For sure. And we're starting to see countries kind of just make their own patchwork rules. And, it's just going to be really interesting to see how that all rolls out. But as Alex said, we shouldn't lose sight of the fact that in Canada, we're in a very, as she said, elite global club. And we are very privileged to have the access that we do to so many vaccines.
I know there's a section of people who are listening who are also wondering, back in March, we were all thrilled that there were millions of doses of AstraZeneca coming our way. So what's happening to that allotment now, Alex? We still have hundreds of thousands of doses in freezers. What happens to all of that vaccine that does work? It is good.
I think that's very much an open question right now, but an important question. So when I checked in with Health Canada last week, they said we have about 600,000 doses in freezers somewhere around the country right now, or around fridges, I guess we should say, because AstraZeneca is very easy to store, one of the great advantages. There's also another shipment of about 1 million doses that is scheduled to arrive later this month. And so at this point, like I say, NACI has left a door open to choice. So if people would like to get it, it is available as a second dose. I think that said, there's going to be a very real question about whether or not people want to take this. And so the question becomes, do we, try to encourage people to take it here? Are there situations in which we're comfortable using it? Or do we start looking at, sending it overseas or sending it to other countries where they can really use that? And we've seen Canada kind of take our first little baby steps towards donating vaccines elsewhere. We've looked at, sending our COVAX shipments to other countries where they're needed. I think this then raises another ethical wrinkle where, if we've decided AstraZeneca is not preferred for us, under what circumstances do we send it to other countries? Are we comfortable doing that? What are our obligations to make sure that they're able to use it? That said, it is a very effective vaccine. And I think every doctor I've put this question to has said, the big ethical failure here would be wasting the vaccine. When countries around the world are still facing the pandemic, we have a duty to make sure it is used somewhere.
Right. The only wrong answer is not using it completely, or that nobody gets use out of it.
Exactly. Like if we start seeing these doses go to waste, that's a big fail.
Alex, May, it's great to talk to you. Thank you for helping break this down.
Thank you so much for having us. It was great to chat.
Thanks, guys.
And that is Alex Boyd and May Warren, two Toronto Star reporters on the AstraZeneca vaccine. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Chung, Saba Aitazaz, and Raju Muthar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.